So we see a lot of people with neck issues, headaches, and there's some really common conditions that'll create a lot of this neck pain, tension in the shoulders, headaches, all sorts of different issues. And one of them is postural stresses or postural trauma. And a big part of it we see is people using phones. Whether they're on their phone or they're studying or they work at a computer, but their head is forward and that really stresses and strains their neck and it can actually create them to lose this cervical curve that they're supposed to have in the neck. So this is an example of a normal x-ray on the left, and see how there's that perfect 45-degree curve? That curve is what protects the joints, it protects the discs as well as the spinal cord. In her case, she actually lost over 40% of the curve in her neck. And so it will load the disc, it creates extra stresses and trauma in the joint, it accelerates any kind of degeneration process, but it can also create a lot of stress in the muscles, creating neck pain, stress in the shoulders. In her case, she also had some stress in the upper part of her neck, which is what's causing things like headaches or migraines. And so we're going to show you how we can actually start to correct it. And there's two ways. We do some manual adjusting, and then we have something called an arthrostem for anybody who really doesn't like to have a manual adjustment. So let's show you how we adjust the spine. So I'm going to palpate. And so we can feel that right there. So as I'm looking at the x-ray, we're looking at her and feeling her neck, and so we can find right there. So that's the problem, and so we're going to adjust that area of the spine. So lean here, relax it, let it go. Good. And then right here, this is that upper part of her neck where she's getting the headache issues from, so we're going to stretch, relax it down. Good. See, that was perfect. So the second way we are working on adjusting the curve is by using this arthrostem. Or if someone really doesn't like the manual adjusting or they don't like the popping, then this works really well. Sometimes we use it instead of the manual, but sometimes we do both, a combination of the two. And so we're going to work down her spine, working with each individual vertebrae to get that curve restored so we can get pressure off of those discs and get stress off of that nerve system. And just like that, she's adjusted.